Yeah, so we are learning more and more about the importance of the transition to parenthood more generally and thinking about the psychological and neurobiological processes that unfold during pregnancy. And we know that for the vast majority of birthing parents, they're thinking about the baby before they arrive. And that relationship between parent and baby is emerging during pregnancy. And there's accumulating evidence to suggest that parents who have a stronger attachment to the child during the pregnancy have more positive outcomes for both their own health and well-being, but also in terms of the child's development too. So creating a space where we should be thinking about parents' relationships with the developing child, even before birth, seems to have important health implications across generations in the postpartum period. So we were looking at an objective measure of maternal fetal movement where we were using a Doppler to look at movement from the fetus that we were measuring there and just looking, more broadly at just the frequency of movement. So how long a baby was moving during our 30-minute recording window. And then we wanted to see if that level of movement was associated with how mothers perceive their relationship with their child. And what we saw across the board was that mothers who had more active fetuses, the baby was moving more during our experimental session, were also reporting higher levels of attachment towards their fetus or towards the emerging child too. So we were really excited to see that because we were using an objective way of measuring fetal movement that traditionally researchers will ask mothers to say, how often does your baby move? Give, kind of indicate every time the baby's moving. So it's really a subjective, a self-perceived amount of movement that mums are reporting. And in those studies, they've seen positive associations similar to ours that mums who perceive their baby is moving more also have stronger attachments to the child. We were able to show the same thing, but using an objective approach. So using this Doppler-based measure, so you're to kind of get that more of a quantitative objective measure showing exactly the same relationship. And then we adjusted for things like parity, if mothers knew the sex of their baby and some other factors, and our results held there too. So we were pretty excited to see the replication, but also the extension of the work, showing this link between the amount a baby is moving, and how strongly attached mothers are to the baby. Yeah, it's such a good question and at the heart of all the work that we're doing. And certainly we think the space to be talking about an attachment relationship to the child in utero, so in pregnancy, and that there could be an opportunity for prenatal care providers to be speaking with their patients around how they're thinking about the child. Do they, how they're perceiving their relationship with the child at this point. There's been some interesting randomized control trials that have been looking at fetal movement counting as a way of improving maternal fetal attachment. It's not just simply counting the movement that seems to be important, but more about how mothers are engaged with that movement counting. So, kind of thinking about the baby as well as feeling the movements as well. So we think there's an opportunity there to introduce a very kind of cost efficient, low tech way of helping to improve the emerging relationship between mum and baby that can happen during pregnancy by thinking about the signal from the baby as being kind of a communicative bid there to foster that emerging relationship. So we know that traditionally fetal movement monitoring is of critical importance in terms of being an indicator of the health and well-being of the developing child. And so for the most part, that's how we typically think about fetal movement is that baby's here, they're alive, they're kicking, and that it's the first indication of any change in fetal movement that, or especially if there's a decrease in fetal movement or an absence of fetal movement is a reason that patients will contact their providers. We're saying that that is still true, and that's a really critical to the health and well-being of mum and baby. But also, we can think about these results and leveraging them to help inform the psychological component of pregnancy and be thinking about that emerging relationship. And we know that the earlier you intervene to support families, the better the outcomes for those families too. And so we often will think about, well, why wait to do interventions to help support parent and child postpartum when a lot of these processes are unfolding in pregnancy, and provides an opportunity there that we can be supporting, not only psychological health, but also physical health much earlier. No, just I really appreciate the opportunity to talk about the research. We're excited to see where this goes next. So we're just working on some studies now where we're looking at maternal brain activity and how that's associated with maternal fetal movement to understand how the baby might prime the changing psychology and biology of pregnancy. And then we're also hoping to extend and replicate these results in more clinically relevant samples. So this is more of a community-based sample, but looking to see do these associations between fetal movement and maternal fetal attachment exist in samples where there may be challenges to that forming bonds during pregnancy and postpartums in the context of depression or anxiety to understand the generalizability of these results before then the long-term goal of trying to think about how we can translate this meaningfully to interventions.